Hey guys, welcome to Ask Pharmacist Tish. How is everyone doing? I am so excited to see everyone. If you're not watching now, please make sure and share, and subscribe on the replay. Share your comments and your thoughts below in the comment section if you're watching the replay. And if you have any questions or anything, please leave it in the comment section and I will be glad to get back to you. My name is Tish. I am As Pharmacist Tish, and I am here to share my 20 plus years of pharmacy knowledge with you. And I am here to add value to your life by giving you knowledge of medications, of self care, and also to save you money. So that is very, very important. Like I said, if you're watching a replay, just leave your thoughts below in the comment section, and we will go from there. So today we are going over the top reasons why people go to the pharmacy and ask questions on their self-care needs. And some of the things are ailments that can be taken care of from home. And so that is why we are here. Let's see here. So a lot of is about to be coughing, well, it's cough and cold season, but we're about to transition into the allergy season. So a lot of people have been coming into the pharmacy with stuffy nose, and sometimes if you let the stuffiness go too far and let all like you know what? Let me back up for a minute. I did not introduce my co-host today. My apologies. So this is my co-host Cody. If y'all know me, this is one of my fur babies, and he was so determined to um, be a part of the live stream and share his knowledge as well, or at least give me comfort while I do so. So I just wanted to back up and introduce him as well. So either way, so back to the allergy season and sinus infection. So a lot of times, if you don't take care of the cough and cold symptoms or the allergy symptoms, and you have, like, let's say, a lot of congestion, and as I always say, if you have a lot of mucus buildup and a lot of phlegm or stuff of that nature, that can lead and breed bacteria, which can turn into an infection. So a lot of times people have sinus infections, and to be honest with you, there are things that you can do to treat it from home, but you have to see your medical doctor to get an antibiotic. So, disclaimer, medical doctor for a sinus infection. But what I can help you with is to give you comfort and support until that doctor's appointment go through, and the doctor can give you an antibiotic to kill the actual infection. And a lot of times after infection, sometimes doctors kind of forget that you need some extra support with medications because you may still have the residual stuffiness and stuff of that nature. So we're going to go through that. So for a sinus infection, a lot of times people come in, like I said, with the congestion, the irritation, the pressure around the eyes, pressure around the ears, and this overall headache, a blazing headache. And I always recommend Sudafed. So Sudafed is my number one product, and as I mentioned in another live stream before, the one that I prefer is the Sudafed that you have to go to the actual pharmacist counter. So it's behind the counter. It's not a prescription, but it is federally regulated because you can break it down into crystal meth. So that's why it is behind the pharmacist counter. You do have to show your driver's license for it. So what Sudafed does, it relieves all of that sinus pressure. If you have like that earache, if your eyes are really killing you, that really helps out. And those tend to be the symptoms of a sinus infection. So that really, really does help out. Even after you've been given an antibiotic, it is also good because it helps relieve a lot of the pressure, because even after you kill the bacteria, you may still have some of the residual pressure, the tension, the buildup, the air ache because of the sinus being filled up with fluid. So Sudafed is really good for draining out that fluid and help out with the pain and the pressure. Now, you can get Sudafed over the counter, OTC, but it is a weaker version of Sudafed. So it will get the job done if you're really pressed for some Sudafed, if you really need that pressure relief, but it's not as good as the one behind the pharmacist counter. And you do need your driver's license. So if you need it, and if that's your preference, make sure you have your driver's license. And it's only a certain amount that you can get per month. But usually one box, and not even you would need the whole box, that would help you with that sinus buildup and pressure. But the main thing is, if you have a true sinus infection, usually only an antibiotic is going to take care of that, and you have to go and see your medical doctor. And a lot of times you can see your doctor virtually or with telehealth. So that really does help out a lot. So that is the main thing with this Sudafed. And a lot of times you may want to, just as an aside, you want to use maybe some ibuprofen or some Tylenol that also help with the pain. Meanwhile, yeah, some ibuprofen may be good. I'm sorry about that, but that helps out a lot. So for a sinus infection. So the question is, how do you know you have a sinus infection? So besides from the pain, the buildup, the pressure that you may experience around the facial area, the ears, and the eyes, whenever you blow your nose, a telltale sign is if you have any like green, yellowish phlegm, or snot or whatever that comes into the tissue. If it has like a funky green color or yellow color, that usually will mean that you have an infection, and that needs to be seen and treated by your medical doctor. All right. So the next thing a lot of people have been coming into the pharmacy for is for a canker sore. So a canker sore is inside the mouth, like it's like the gum area. You have like a lot of pain. It's just is you can get food inside. It's like a little break in the skin in your mouth, and it's a small opening in the mouth, in the gum, not in the gum area, but like in the inner of your lips, in the cheek area. And it's very small, but it can wreak a lot of painful havoc. So a lot of people come into the pharmacy asking for a good product for canker sore. So my favorite product for a canker sore is Canker. And so that is really good for a canker sore. And basically, how do you get a canker sore? I used to get them a lot in college because of the stress. You can get it from stress. I used to have a bad habit of chewing inside of my cheek area with my teeth, of course. And it just, you get a break in the skin, and it just would wreak havoc. And the bad thing about it is you have to let it heal on its own. So the canker will help with the pain, give it a nice coating while it heals on its own. And the bad thing about it, whenever you have any ailments inside the mouth, because it's a wet area, there's a lot of motion with chewing and swallowing and stuff like that. It does take a little time for it to resolve. So canker is really good to help with the pain and while it smooths over, and go from there. Before you use the canker, though, I like to use Orajel mouthwash, and I like it better than like regular mouthwash like Scope or Listerine, because it is not as irritating, but it gets the job done. So imagine having like a canker sore inside your cheek, or inside your lip area, and then you try to put some Listerine on that. That is going to really burn. So the Orajel is a nice cleanser. And it's important to keep your mouth clean, and it's good to use this Orajel mouthwash because it helps get the debris out, all the food, and just kind of soothe it as well. So it's good for mouth sores. And after you gargle with it and coat the mouth, and then you can use the canker to help numb the area. And it should resolve when you use these two items. It should resolve within like a week or so, but it does take a little bit of time. So it's not something that you use the canker and it's going to go away like an hour or two. It does take like a good week for the mouth to heal and to get a full resolve. So that's a good product to use if you have a canker sore. Now, along with the canker sore, a lot of people, and this is year round. This is not a seasonal thing. When it comes to toothache, a lot of people come in hollering like an alley cat because it's just gotten out of control. Sometimes it become infectious, and usually for a toothache, that indicates that you need to see the dentist. So we may have some kind of infection or however it may be. But a lot of times people come to the pharmacy to get some type of relief so they can be able to sleep through the night and have some relief until they can see their dentist or make an appointment. So we have that like all the time. It's always a patient at least once a day with a toothache ailment. And so my favorite products are, of course, I always tell the customers or patient to start off with some ibuprofen to start off with. So ibuprofen is a really good product to help with pain and inflammation. You can use Tylenol as well, but I prefer ibuprofen because it also helps with inflammation, whereas Tylenol only helps with plain pain. This only with pain. It has no anti-inflammatory properties, whereas the ibuprofen does. And when you have a toothache, the gums are inflamed, the tooth area is inflamed. So that's why I prefer ibuprofen. You only use Tylenol when you're desperate, if you have nothing to get your hands on, but it's really not going to help like the ibuprofen. So this depends on the severity of the pain and your weight, or however, it depends on how much ibuprofen you would take. So that's something you can discuss with your community pharmacist, and they can help you with the dosage. But ibuprofen baseline to help with that pain. The next thing I like to use is toothache by First Aid. It's called toothache, but it's a first aid. It's by First Aid. Now I like this over like the Oragel and those kind of products because it has a drug called eugenol in it, and it's a different type of anesthetic, and it really gets to the bottom of that pain. Now, as anyone know, if you ever had a toothache pain, is almost is nothing really helps except going to the dentist to get it resolved, whatever the issue may be. But these items will help tie you over until you see your dentist. So it's really nothing else to use. It's nothing else that you can do. It's something you definitely have to see your dentist for. But when you come to your pharmacy, we can give you something to tie you over and help out with that pain. And hopefully you can be able to eat. Hopefully you can be able to rest, or whatever it is that you need to do with your day. Get some type of relief until you see your dentist. So that is that. Also, I may recommend, because sometimes the first aid product is hard to come by. In that case, as long as you have your ibuprofen, I also would recommend Oragel. If you can't find the first aid toothache product, then Oragel is always the good oldie but goodie. It has the benzocaine and all the other products that help with the numbing, and that's all you can do, is just try to numb the area as much as possible to help with the pain. So Oragel is my second favorite choice if you can't find the first aid. But no matter what you use, unless you're allergic to ibuprofen or aspirin-like or ibuprofen-like products, then definitely use the ibuprofen along with the first aid or the Oragel. And then, of course, going back to the Oragel mouthwash, I recommend that because a lot of times when you get food and debris in your teeth, in your tooth area, that can aggravate the pain. Just, that food sitting, in that gum line or getting inside that tooth, and it can really wreak extra painful havoc. So it's really good to, keep, your mouth washed out. And this Oragel, like I said earlier, it has like a really smooth feel to it. It gets the job done. It's not harsh like the Origin, like the Listerine or the Scope, and it's designed to help with mouth sores or any kind of mouth ailment when there's great sensitivity involved. So that is something good to use as well. All right, so we were in the winter season. We had a lot of issue with dry eyes, but it's something that a lot of people I'm noticing have issue with, which is the dry eyes. And it can happen for dry eyes can happen for so many different reasons. It's just something that happens. Some people are like, well, why do I have dry eyes? Some things, it's the human body. Things just happen. Okay. Sometimes it can be like a inflammatory issue where you have to see the eye doctor and it's more advanced and you need like a prescription. But a lot of times, doctors or eye doctors, they prescribe or they recommend rather a product called Sustain. And so that's one of my favorite go-to products because I see a lot of the eye doctors recommend it. So it brings lubrication and balance to the eye. Of course, you can use like the Visine drops, any of those type drops, but Sustain, even though it's more pricey, but it really gets to if anything's going to work, this is going to work. So I always recommend Sustain for dry eyes. And if that doesn't work, then you have to go see the doctor, and it may be a more advanced issue. When it comes to the eye, that's not something I usually play around with, but sometimes it just happens. Just for any number of reasons. So this is a good product to give a try for and give some relief for the dry eyes. The next issue that comes about, especially coming about with springtime, and it's going to get warm, and a lot of people are going to go in the pool and they're going to get that water in the ears, or just in general, a lot of times if you have a lot of buildup in the sinuses or in the ears, and then if it keeps the fluid sticks around, it can go into an infection. So for an ear infection, so a lot of people, they do complain about that multiple times a week. We have a lot of patients that come in and they have complaints about an ear infection. So let me go ahead and put a disclaimer out. If you have a true ear infection, there is nothing that you can do pharmacy wise that will help with the true infection, because whenever you have an infection, you have to kill the bacteria. Usually infection indicates some form of bacteria, and you have to kill it with a antibiotic. So there's no antibiotics over the counter. You have to see your medical doctor, or that's something you probably have to see the doctor for, not virtually. But either way, the prescription for an ear infection is relatively cheap. So it's definitely worth the visit. And plus the pain is so phenomenal. It's not something you can just kind of overlook. So for an ear infection though, we can help out by giving some type of relief to tie you over until you see the doctor. So a lot, you can't get to the doctor a lot of times like right away. So a lot of times, we can give some type of relief and help until then. So for an ear infection, I like the Similacin ear relief drops. Probably not saying it right, but y'all see the picture, right? Okay. So for ear infection, you want some type of relief from the pain. So this is a herbal product, a homeopathic product. A lot of people I recommend this to, they do come back and say it works. So whenever you have an ear infection, a lot of time pain comes with that. And so this will at least give some type of relief until you can see your doctor. Along with that, I also recommend ibuprofen to go along with it, because it does help with the pain and inflammation. So I recommend two things for ear infection. Um, ibuprofen to help with the pain and inflammation. Once again, I definitely recommend that over Tylenol. And then some of the earache drops, the homeopathic earache drops, and that would definitely help out until you can see your medical doctor, and they can give you like I said, it's usually a really cheap antibiotic that can help with the ear pain. Actually, if it's not too advanced, even if the doctor should write for a prescription that's really expensive, you can talk to your community pharmacist, your pharmacist, and they can call the doctor on your behalf and have it changed to a prescription that can be $4 in a lot of cases, like pharmacies like Walmart, that I know of for sure. There are ear antibiotic drops that can be given for $4 by the medical doctor. But of course, doctors, they're very busy, have a lot going on. So they're not on top of what the price points are on prescriptions, but that's what we are here for. So if you have an eardrop prescription and let's say it's like $50, $60, and if your insurance doesn't pay for it, or if it's even like 20, dollars or so on the prescription insurance, talk to your pharmacist and like, listen, this is more than I wanted to pay for. Is there anything to do to make this more cost effective for me to use? And then we can just give the doctor a quick call. And after we get all of that done, then we can get you a prescription, a lot of times for $4, but that's up to the doctor's discretion if he would change it or not, if he did not write for a cheaper product in the first place. All right, so gout. So, how do you know you have gout? A lot of times people know they have gout for the first time is when they have that pain in that big toe. You're laying down and you're in bed, your toe is on fire. You cannot even tolerate the weight of your sheets on from your bed to lay on your toe. That's how you know you have a lot of times gout. And plus, it's not just in the big toe. You can have like, gouty elbows, gouty knees, and it's basically a buildup of uric acid crystals, and it becomes inflamed because it's not supposed to be a buildup in the first place. And so, anyone who has gout, you know how wicked the pain is. The pain is just absolutely phenomenal. So, as you know, anyone who's experienced it, there is nothing you can do about gout over the counter. Like you have to go and see your medical doctor first to get it diagnosed. But for the people who's already been diagnosed and been given a prescription and happen to have run out of the prescription and need something to tie you over until you get a refill on your prescription or until you see your doctor again, there are some few products I can recommend that can help ease the pain of the gout until you see your doctor or get the prescription that you need. So, back to my all-time favorite, ibuprofen. When you have a gouty, what they call a gouty attack, is a lot of pain and it's inflamed, it's hot, is just wreaking havoc. It's wicked. There's no other way to describe it. So ibuprofen is really good to help with the pain and inflammation. And to be honest with you, is it going to really touch it? I mean, some people say it may work, some people may not. But when you're desperate and it's like, 8:30 at night and you having a gouty attack and you don't want to go to the urgent care or emergency room or whatnot, if you want to wait until the morning, then some ibuprofen may give you some relief and from the pain and the inflammation. Also, I would recommend, for people who are stubborn and think they can ride this pain out. We have some of those, patients that they just refuse to go to the doctor unless, they just rather just ride it out. So turmeric, curcumin rather, is a prescription. It's not a prescription; it's a vitamin, and it's in the vitamin section. It's a supplement, and it has a lot of anti-inflammatory properties. So it's used for a wide range of of ailments. It's just good. A lot of people take it every day. Actually, I make a turmeric paste for my skin to, just to kind of get my skin cleared up. So it has a lot of different uses, but you can get in a capsule form, and a lot of people can use it to help with gout. For those certain people who just refuse to go to the doctor, so it helps out a lot. It's not gonna be like prescription stuff, like the colchicine, the allopurinol, those type products, but you know, it will definitely, hopefully, take the edge off. Gout is so the pain is so relative and is so variable. It's really kind of hard to say. It's not a direct hit when it comes to taking care of the pain. Another weird thing that I recommend is tart cherry extract. That helps with, like, it also has anti-inflammatory product properties rather. So sometimes, if someone already taken to turmeric, or they, it's like, try some tart cherry, why not? So that's what I like to tell people, to give it a try, and it may help. So whenever you have a gouty attack, I recommend the ibuprofen to help with the pain and inflammation, the turmeric, or the tart cherry. But as you know, when you have that kind of pain, and the pain is this phenomenal, it's really nothing else that you can do except see your medical doctor and get treated. So those are the top ailments that a lot of people go to the doctor for. And to do a recap, I'm going to do a quick recap. For sinus infection, as I already said, there is nothing you can really do to kill the infection per se, because whenever you have an infection, a true infection, and a lot of times you have an infection is when you blow your nose and you may have yellow or greenish kind of snot or something like that. That usually indicates an infection. That usually means you need a antibiotic. And as you know, there aren't any antibiotics over the counter. And so I recommend the Sudafed, even though Sudafed will give you some type of relief from the pressure, the pain from the eyes, the ears, the face, but it's not going to kill the bacteria, and it's not going to totally get rid of the infection. So you have to see your medical doctor for a true sinus infection. But if you have gone to your medical doctor and they say, they give you the antibiotic, which is relatively cheap, that's also usually a $4 drug that you can get, like a pharmacy like Walmart. If it's not too advanced, you can, take that. And then the Sudafed also will help, with that naggy irritation and pain. For a canker sore, I recommend a couple of products. A canker sore can come from stress, from chewing inside your mouth, just sometimes people have a nervous tick, and I used to do it in college because my nerves was tore up in college. But either way, canker sore is really canker is pretty good. It helps with the pain, numb the pain. You want to keep your mouth cleaned out properly so the food won't set into it and make it more irritated. I like the Orajel mouth sore mouthwash, that helps out. For a toothache, you know, when y'all come in hollering like an alley cat, I mean, it's so sad, because I see some of the biggest men, and it is that toothache pain just have them weak in the knees. They just crippled from that pain. They just have their little rag in their hand, they spitting in it, and this is like, oh my God. But it sometimes this just gets crazy with the toothache pain. If you can't make it to the dentist, y'all just come into the pharmacy, and it's just so sad. I feel bad. That's the only time, when customers are really humble. But either way, besides the point. But I recommend ibuprofen, that helps with pain and inflammation. Um, Over Tylenol. If you have Tylenol, use it. It's better than probably nothing, but I think it's probably the same as taking nothing. But ibuprofen helps with pain and inflammation when you have an inflamed tooth, or gums or whatnot. You want something with anti-inflammatory action, and that's ibuprofen. The toothache first cross I think it's, yes, it's for Red Cross rather. By Red Cross, I say First Cross or First Aid, but it's actually Red Cross, and it has the eugenol in it, and that helps out with numbing the area. I think it's more so effective than Oragel, but sometimes some stores don't carry this product. So, if you have to take the ibuprofen with the Oragel, and you just do what you got to do. And then, of course, keep your mouth washed out with some Oragel mouthwash, because you don't want food settling on an irritated tooth. It does make things worse. For dry eyes, this winter time, but people have issues with dry eyes all year round. It's just something that can happen, or it can be some type of inflammatory issue, which the medical doctor or the eye doctor would need to look into. But just for regular dry eyes, our over Visine or any of those cheaper products, I recommend Sustain. And that's is a little more pricey. There is a generic for it. So anytime I talk about products, always get the generic of it. And I'll let you know when there's certain products that I do not recommend generics for, but all of the products, generics are fine. Sustain is good for making sure to get your eyes balanced, the moisturization balanced in the eyes. So it's a really good product. Generic is fine. For an ear infection, like I said, when you have a true ear infection, is really nothing you can do over the counter for it. You cannot kill an infection over the counter. You cannot go to your pharmacy and get an over the counter antibiotic. There's no such thing. This is America, and if you need an antibiotic, you're gonna have to pay for it. You're gonna have to go to your doctor. You're gonna have to go through the motions. You're gonna have to come to me and pay me to dispense your product. You have to go through the whole thing. So it's not like other countries where you can get get it over the counter, which is so super convenient, but that's not going down in America. So ear infection, this earache relief I recommend is a homeopathic product, and it's really good, and it will at least tie you over until you can see the doctor, or tie you over to see if it's a really if it's a true infection, ear infection. And a lot of times, if this product doesn't help, along with some ibuprofen, and if your ears are still like really aching and have the whole side of your head just feeling this horrible, then you need to see your doctor. But a lot of times, and that's one good thing about your community pharmacist, we can kind of get to the root of things instead of coming back and forth and trying different products on your own and stuff like that. I always tell people, I say, listen, we're gonna do this product, we're gonna do that product, and those don't help, then that's when you have to see the doctor. There's no finding other products, there's nothing else you can do. So we can save you time and money that way. So with the earache, you try that. If it works, great in a lot of cases. If it doesn't help, then you need to see the doctor. All right. And then for gout, we have the ibuprofen for pain and inflammation. And like I said, for a true gouty attack, the pain is so intense, is really nothing you would want to do except just hobble over to your doctor and get some pain relief. A lot of times you can do a lot of self-care. If you're prone to gouty attacks or getting gout, there are certain foods that you can back off from, like red meat causes issue, certain types of seafood. If you like a beer, if you're, like your alcoholic type drinks and stuff like that, that can exacerbate the gouty attacks, or it can cause it in the first place. So if you are prone to having gouty attacks, then you want to do more research or contact me, and we can go over your dietary habits, and we can talk about what you need to cut back on and what you need to add on more of to prevent that from happening. So something that from dietary standpoint can a lot of times be prevented. A gout can be prevented. But either way, ibuprofen for pain inflammation. So turmeric or curcumin, that helps out, for the stubborn people that just like to feel feel that gouty pain and refuse to go to the doctor. And then the tart cherry extract, that is something to give a try for. And that is basically it. Hopefully, this was helpful. Always for the future, I will always be doing lives. So once the channel grows, I will be here for any kind of questions. I am confident. I have been doing this for a while. So when our audience grows and stuff like that, y'all can throw all the questions at me and I'll be able to take care of it. So I want to get us grown to that point where I can be on call, or I can you can save your questions up and I can always be available to answer them right then and right here for you. So either way, I appreciate y'all. Oh, my little co-host went to sleep. I bored him. Hopefully I didn't bore y'all. Yeah, he went to sleep. So I had to have him today because he was not having it. He was so excited and he wanted to be a part of the live stream today. So I see I have a couple of people. Do you have any questions or anything? I'll be glad to answer them. So no questions or anything. Hey, not so awesome, Larry. How are you? Appreciate it. Do you have any questions or anything? If you're still on, not sure. Or anyone else who have any questions, take your time and ask me. I'll be glad to answer them or whatnot. So, but either way, if there aren't any questions, I will check y'all out the next time. I appreciate y'all. Like I said, remember to like, share, and subscribe to the channel. If you have any questions, you can leave it in the comments section and I will get back to you very, very promptly. All right, y'all take care and y'all have a great evening. Take care. Bye-bye.